Right, you've been waiting for this. We've talked about this, that I was going to bring my surgeon, my doctor on about my shoulder surgery, Dr. Joshua Tuck from LECOM Health. Hi, how are
Hello.
you?
Thank you for having
And
me.
tell everybody what a wonderful person I am.
An amazing patient.
Thank you very much. I've had several surgeries with you, but the rotator cuff's been the big one, obviously.
Right.
So this is my second one. So briefly tell people what happened to me this time.
Well, we're not entirely sure, but you appeared to have some injury at some point because you tore 3 tendons in your shoulder.
Yeah, so we have this little thing here. Maybe, I don't know where we can get that, but just talk about the 3 tendons. There's 4 tendons in the shoulder?
There are 4 tendons that make up the rotator cuff, and the subscapularis in the front, the supraspinatus and infraspinatus over the top, and then the teres minor in the back, which is seldom torn.
Yeah.
You managed to tear the subscapularis in the front, and then the supraspinatus and part of the front of the infraspinatus as well.
So I did a good job.
You did a
So we call that
remarkable
global destruction.
That's global destruction, grenade level. And you also, the long head biceps tendon over the top of the shoulder here was torn on you as well.
And so you dug into me with these tools, of course.
Right.
But what I think is most important, that I do have what we have anchors in my body.
That's
so
right.
Show us what happens there. So we actually drill into the bone to fix this.
We do. So we drill into the bone, and these anchors, they're made from a variety of materials. These anchors are biocomposite, so they absorb on their own in several years, which is nice. And then this right here is what you have, a double row repair, knotless, where these sutures are then carried down from an inside row of anchors captured to an outside row of anchors in a crisscross configuration, sort of like so. And that keeps the rotator cuff down where it belongs.
Yeah, now you told me that I had 5 in this one, but I had 6 anchors. Is that
You
a lot?
That's a fair number.
Is like a badge of honor?
It is a badge of honor. That's a fair number of anchors in a relatively small space, yes.
Yeah. So when we talk about the, I'm not prone to this. I actually had some injuries that may have fallen.
This evening on Erie News Now, a controversial conference is in Erie this week, and industry experts are covering the areas of fracking and energy. We have the details tonight. Plus, we have an update on the...
All right, there's a little tease with Eva there. A lot of people come up to me and tell me how they have rotator cuffs or their arms hurt of that. So tell us the difference between a rotator cuff tear injury. What should people know?
Sure.
Is every shoulder injury that?
It's not, no. In fact, the majority of shoulder injuries probably are not that. And so they're uncommon under the age of 40. But they're exceedingly common over the age of 70. And so we think about 40% of people over the age of 70 have asymptomatic rotator cuff tears. So not every rotator cuff tear needs to be repaired, but typically for someone with new onset shoulder pain in the absence of an injury, the initial evaluation may involve x-rays, but usually a trial of non-operative management before going to an MRI.
And usually how successful are these surgeries? Mine, this one's perfect. So
excellent. Thank you. Thank you.
So let's hope this one does it
right.
too.
So the overall success rate is very good with rotator cuff tears and repairs, but a lot of factors depend on the success of the surgery, the age of the patient, the acuity of the injury, the degree of fatty change to the muscle.
And so basically with me being my early 50s, we thought this was a good idea. Now, if I didn't do it, then there could have been cause for alarm down the road.
Correct, yeah. So we know that full thickness rotator cuff tears generally in time get worse. They start to turn to fat and they can become irreparable.
All right, well, thank you, Dr. Joshua Tuck,
LECOM
Health. I did give him permission to talk about me, so HIPAA, go back home.
That's right.
And of course, we'll have more, and he said I can take this off today.
You can take that off
I
today.
can finally take this off. We'll talk more
Congratulations.
about this. Thank you very much. Oh, it hurts. No, it doesn't. We're fine. We'll have more Erie News Now at 4 coming up in just a few. First.